Good morning, ma'am. I am RJ Lambus and I'm here to demonstrate the assessment of skin, hair, and nails. For the preparation, introduce yourself, verify client's identity, explain what you are going to do, why is it necessary, and how the client can cooperate. Magandang umaga po, Nay. Ako si RJ. Ako po yung nurse niyo ngayong araw. Kayo po ba si Nay Julieta? Patingin po ng wrist tag ninyo. Okay, ang gagawin po natin ngayon is i-assess po natin yung skin ninyo, yung buhok, tsaka po yung mga kuko ninyo. Okay lang po? Next is to assemble equipments and supplies. The magnifying glass, the millimeter ruler, and the examining gloves. Next is to provide clients privacy and dignity by always closing the doors and also curtains and draping the patient. Next is for the assessment of the skin, determine client history of the following: pain or itching, the presence or spread of lesions, bruises, abrasions, and pigmented spots, previous experience to skin problems, related systemic conditions, use of medications, lotions, and home remedies, and excessive dry or moist feel-toe skin, and tendency to bruise easily, and any association of problems from season of year. For the assessment, inspect the skin color and inspect the uniformity of the skin color. Titingnan po natin yung kulay ninyo at kung pare-parehas po ba ng kulay. Next is to inspect, palpate, and determine lesions and apply gloves if lesions are open or draining. Titingnan po natin kung meron po tayong mga pasa or mga lesions. Next is to palpate lesions to determine its shape and texture. I'm going to palpate lesions. Since the lesion is not open, I can palpate it. Okay. Next is to, after inspecting the lesions, observe and palpate skin moisture. Okay, tingnan po natin yung moisture ng skin ninyo, kung dry po ba or hindi. Next is to palpate skin temperature. Compare 2 feet and 2 hands with the back of your fingers. Titingnan po natin yung temperature ng kamay, tsaka po ng paa. Okay, next is to assess edema, the location, the color, the temperature, the shape, and the degree of angle of the skin which remains indented or pitted when pressed by a finger. Okay, titingnan po natin kung meron po tayong mga manas. Okay. Next is to note for skin turgor for the fullness and elasticity of the skin by pinching and lifting the skin in an extremity. Since that my client is a senior citizen, I am going to test there is elasticity the skin below the clavicle. Ngayon po, titingnan po natin yung elasticity dito po banda. Okay, ito na po. Okay. Next is to remove gloves and perform hand hygiene. Next is for the assessment of the hair, determine client's history of the following: the recent use of hair dyes, rinsing, curling, and straightening of the hair, and recent chemotherapy. So, Nay, gumagamit po ba kayo ng mga pangkulay ng buhok?
Oo.
Okay. Kinukulot niyo po ba or nagpapa-reband po kayo ng buhok?
Hindi.
Okay. Next is to inspect the evenness of growth over the scalp. Titingnan po natin kung meron po tayong mga part ng buhok ko na nagkakalbo na. Kung pantay-pantay po ba sila o hindi. Next is to inspect hair thickness or thinness. Ngayon po, tinitingnan po natin yung kung makakapal po ba or maninipis yung buhok ninyo. Next is to inspect hair texture and oiliness. Okay, hindi naman po oily yung buhok ninyo. Next is to inspect scalp for lesions and hair and scalp for the presence of lice or nits. Tingnan po natin kung mayroon pong mga lesions ulit yung inyo pong scalp. At meron po bang mga kuto or mga lisa. Next is note infection or infestations by parting hair in several areas and by checking behind the ears towards the hairline at the neck. Tingnan po natin dito. Okay. Ito din po sa kabila. Okay. Next is to inspect amount of body hair. Okay. Next is to document findings in client records. Next, for the assessment of the nails, determine client history of the following: the diabetes mellitus, peripheral circulatory disease, severe illness, and previous injury. Anay, meron po ba kayong sakit na diabetes?
Wala.
Okay po. Next is for the assessment, inspect the nail plate shape and determine its curvature and angle. Ngayon po, titingnan po natin yung shape ng kuko ninyo. Patingin po ng isa. Tingnan po natin sa paa. Okay. Next is to inspect fingernails and toenails for texture. Tingnan po natin. Next is to inspect fingernails and toenails bed color. Ngayon naman po, titingnan po natin yung kulay ng kuko ninyo. Dito din po sa paa. Next is to inspect the tissue surrounding nails. Pagkatapos po, tingnan naman po natin yung mga balat na nakapaligid sa kuko ninyo. Okay. Dito po sa paa. Next is to palpate fingernails and toenails and perform blanch tests for capillary refill and press 2 or more nails between your thumb and the index finger and look for blanch and the return of pink color into the nail bed. Ngayon po, Nay, titingnan po natin kung ipipress po yung mga kukunin nyo. Titingnan po natin kung magkukulay puti po at kung babalik po yung kulay pink na kulay. Okay. Pati po sa paa. Okay. Okay naman po so far. Next is to pagkatapos po, next is for the documents findings in client records. For the evaluation, perform a detailed examination for other individual systems based on findings that deviate or expected or normal from the client, and relate findings of the previous assessment if available.